Hi everybody, I'm Dr. Friedman here at Bechtel Physical Therapy, and today I'm going to talk a little bit about posture. We're going to talk about some of the benefits of posture, as well as some of the negative consequences of poor posture, and then we're going to do a little demonstration on what proper posture should look like. Okay, so first of all, what is posture? Posture is the position that your body's in, whether you're sitting, whether you're standing, or even laying down. And good posture is a position that you're able to get your body into that allows for the most efficient use of your muscles, as well as avoiding unnecessary stress on your body. So what are some of the benefits of good posture? Some of the benefits include improved efficiency of your muscles, leading to improved endurance and less fatigue. You have less wear and tear and stress, abnormal stress on your muscles, your ligaments and other soft tissue structures. You can have improved breathing because of better rib mobility. You can also have improved core control, which can help you avoid injuries, as well as just aesthetics, helping you look a little bit taller. Now we're going to talk a little bit about some of the consequences of negative posture. So what are some of the negative postures? Very often people come to the clinic complaining about pain, and they very often are coming in slouched like this. The upper body is slouched, their head is forward, and these can be people who are drivers for work, or people who have desk jobs, or people who just spend a lot of time in front of the computer and they start to slouch. Now this can cause neck pain, lead to headaches, and can also affect the shoulder. It can affect shoulder pain, shoulder function, cause impingement of the shoulder, as well as rotator cuff injuries due to inappropriate repetitive stress. Now this isn't just relegated to the upper body or your neck. It can also affect your lower back. So very often these same people that are coming in like this, when they sit in a slouched position like this. So their spine takes a C shape, and they're putting a lot of stress on the lower back. Now when they get up, a lot of people will straighten out their back, but very often they don't straighten out that upper part of their back that is stuck in that position. They'll compensate because no one's going to stand walking around like this. They're going to straighten out from the lower back, and they're putting a lot of pressure on the facet joints, and both of those positions are going to put a lot of stress on the back and create a variety of lower back conditions. Now we're going to have Steven here. Come on. All right. So you're going to have a seat right here, and we're going to actually, let's turn the chair, face that way. We're going to use Steven as an example of posture. So right now, he's actually not sitting that poorly, but let's imagine for a second that his posture is really bad. So go ahead, sit and slouch. All right, so his knees are actually kind of above his ankles, which is good, but his lower back is in that C shape, as well as his upper back, and it's creating a lot of tension here at his neck. So what we want to do when we're sitting, we want to try and get your lower back to have that nice lordotic curve and get you to straighten out. Once you do that, everything else is kind of simple. He's being a perfect example right now, so he's sitting straight, but very often the head will be slouched forward in that forward head posture or position, and we just want to teach everybody to be able to correct that. So just reverse what I just did. All right, now go ahead, slouch again. That was a lot of work. The easiest thing that I like to tell people to do is from this position right here, imagine that there's a string just lifting you straight up to the ceiling. So go ahead, imagine that string is lifting you straight up, and it's a great way to be able to quickly readjust your posture. All right, let's stand up. Good. Now, the way he's standing looks great. What you want to look for is to have your ear in line with your shoulder and your hip and your ankle. But very often people won't stand like that. They'll stand slouched like that or leaning backwards. What we're going to do right now is we're going to do a little assessment to see where his weakness is. So if he was standing perfectly straight, when I push down, all of the force should go right through his body, and he shouldn't really go anywhere. But right now when I push down, you see his body comes a little bit forward. That's because he was acting for us, and he was standing in that position. So when I push down like that, that's just letting me know that, hey, I want to try and cue him to activate some of his core muscles and to straighten that up. So now, when I push straight down, he doesn't really go anywhere. And for him, he happened to move forward, but he can move backwards or to the sides, and that'll let us know where we want to try and cue the person to tighten up their muscles. So posture is very important. We just showed with Steve, when he's sitting, when he's standing, we want to try and keep him in a good position. But very often we're not just sitting or standing, we're actually doing things. So for example, if you're standing in the morning at the sink and you're brushing your teeth or you're doing the dishes, right? Depending on how much time you're going to stand there, you don't want to be standing and reaching over and doing something that's going to be putting a lot of stress on different parts of your body. You want to try and do things that will help minimize that stress. So something very simple is almost every sink has a cabinet underneath that you can open up, and you can just put your foot in underneath like that. This way, if you're standing and doing the dishes, you can shift your weight forward and put that weight on your leg as opposed to overstraining your back. And this way, you can alternate legs, go from one to the other. And the same principle applies in terms of keeping the weight close to you. You don't want to be reaching over when you have to pick something up off the floor. So this is an example of bad body mechanics. If you just bend over like this, you're putting a lot of stress and strain on the back. You go to lift something, it's very easy to injure yourself. But if you can get yourself nice and close to the object, keep your back straight. You want to use your hips and your knees to get as much of the motion as you can. To bend, to squat down like this, and then you can lift up the object and pick it up and have minimal strain on your back. Okay, so now we spoke about posture and body mechanics. We want to try and look at some exercises that can help you get into a good postural position as well as challenge and maintain it. So we're going to take a look at Steven, who's sitting right here. He's sitting in a good position, but what we're going to practice is an exercise called cervical retraction. So what we want to do is we want to have Steven practice bringing his head all the way forward, go ahead, and then bringing it back. So it's a very simple exercise, but this is very often the muscles that we need to get activated to help keep your neck in that position. So it's not just about straightening your spine here, but we also got to get that muscle activation to hold you in place. Now, as an exercise, you can be moving your head back and forth, but we can progress that to do it in different positions, as well as add resistance to help challenge those muscles. So now we're gonna take a look at another exercise where we're gonna try and have Steven maintain a good posture while challenging his arms. So go ahead, Steven, grab the cables. All right, now, I don't want you leaning back, so try and keep your body straight, good. And we wanna try and make sure that Steven's keeping good posture while pulling. So go ahead. Now very often, a compensation will be as the patient is pulling, depending on how heavy the weight is, they're gonna compensate and go forward. And this is exactly what we're trying to avoid and what we're trying to challenge. So as he pulls back, he's gotta be able to pull and keep all of those muscles nice and stable to keep his neck in the right position. Okay, very good. So now we're gonna move on to another exercise. So the same concept, we want him to be able to maintain normal posture and be able to lift the weights straight up. So very often you're gonna challenge yourself like this at home. If you have a heavy box or something that you need to put up on a high shelf, you wanna make sure that you're lifting the weights and you're not doing something like this or any other compensation. So let's take one weight in each arm. Okay, go ahead and good. You can actually face that way for a second so we can see. So try not to lean back too far, good. And we want to make sure that as he's lifting throughout the entire range, even if you were to lift all the way up, go ahead, Steven, lift it all the way up, that there's no compensation at the neck is not giving or dropping into any position. Okay, great. I'll take those weights back. So that was the neck and the upper body. Let's take a look at some of the exercises we could do for the low back or the core. So we're gonna do a plank. You remember how to do that, right?
Yes.
Okay, great. So, that looks great. Steve is a professional here. Very often what we're gonna see is patients' backs will drop over here, or his low back will drop, and it's gonna put a lot of stress on his back. Or people will stick their butt all the way up in the air. What we wanna do is get into a nice neutral position that we can train the body to keep that spine in neutral alignment while strengthening the muscles. Okay, now you remember how to do a bird dog?
Yep.
Okay, so we're gonna do that now. So the setup for this exercise, so we wanna make sure that his arms are directly beneath his shoulders and his knees are directly beneath his hips, and move them forward just a little bit. Good. And we want to make sure that his spine is in a neutral position. We want to make sure that he's not dropping everything down, that he's lifting it up and keeping it stable, as well as keeping his neck in a good position. So what he's going to do while trying to maintain the spinal alignment is he's going to pick whichever arm he wants and the opposite leg and lift them out. So go ahead and bring it back and do that a couple of times. Every time his legs and arms go out, his body wants to rotate, and he has to control that. And he's training his rotators and training his body as his leg goes out to make sure that he doesn't compensate like this. This is a very common compensation, that the back will overstretch. So as he's going, his abdominals are contracting, his obliques are contracting, and they're helping control that movement. All right, thank you, Steve. Very often, very simply, this happens when you walk. Your arms and your legs move, and you need to learn how to control your back. The goal of this exercise is going to be to be able to lift his hip up like this as far as he can without having movement at his back. So if he's lifting and he starts going like this, that's a fail. Similar to the bird dog, we're trying to train him to be able to move his leg, move his hips, and not move his back. This way his body can learn to dissociate and stabilize his spine. So go ahead, good, and back down. Good, and keep going. And this, as well as many other exercises that we can choose to do depending on the person or depending on the condition, is what we would do to help strengthen the core, help improve posture, and challenge the body for everyday activities. So today we talked a little bit about posture, the benefits of good posture, the consequences of negative posture, and we luckily had Steven here to help us with seeing what proper posture looks like and how to challenge it a little bit. I hope everyone who's watching this takes more notice of their posture and tries to improve it every day. If you ever have any questions, please feel free to call us at our office. We'd be more than happy to sit down with you and talk about ways to help improve your posture and live a healthier life.